all hell breaks loose. Of course, it's so much fun. The babies look so cute, but probably the night's sleep is lost. They're crying a lot, they're fussing a lot, they're putting everything in their mouth. There are so many changes that are happening. So, what are the teething signs and symptoms? A lot of people say that when the child is teething, they tend to get a fever. However, the body temperature can only get raised by zero point 0.2 to zero point 0.5 degrees, not more than that. Any more fever is a sign of an infection and has to be treated differently. Of course, there are behavioral changes like we spoke right now. The children are fussing, they're a little bit irritable, they want to put things in their mouth. And because of the gum irritation, they tend to do that. They put things in their mouth, which is why it's a good idea to provide them teethers. Let's talk a little bit about breastfeeding and teething. There is a lot of biting happening at that particular time. The next thing that happens when the baby is teething is the latch changes. They are nibbling on the breast many a times and not taking the entire areola the way the mothers have been taught that the child should be feeding. They don't take the entire areola inside the mouth and feed. So it's very important, especially when they are dream feeding or when they are feeding in the night, that the child has a good latch. What happens if the latch is not good? The milk pools in the front part of the mouth instead of dribbling into the throat. It pools in the front of the mouth, and if you are not brushing properly, if the child is not allowing you to brush properly, there is a lot of plaque on the teeth. And if there is plaque on the teeth and there is milk surrounding that plaque, the bacteria in the plaque are going to ferment that milk and cause acid. They create acid, and if there is acid surrounding the teeth are going to get decayed. So, how do we make it easier for a baby that they don't feel uncomfortable during teething? The most important thing is massaging. All right, with a clean finger, you massage the gums, and they can self-soothe by holding a teether, biting on teethers. These are all different kind of teethers. If they're feeling discomfort at the back of their mouth, a long teether helps. If it's in the front of their mouth, a short teether helps. How do we alleviate the pain that the young children are feeling? There are various methods. Allopathic medicines are available, which is painkillers. Homeopathic medicines are very, very, very common and popular. Ayurvedic medicines, there are certain flowers that Ayurveda suggests help in alleviating discomfort of the tummy, of the nerves when the child is teething. And of course, every house has their own home remedies. Teething foods to alleviate discomfort of the gums, like hard breads, teething biscuits, and breast milk lollies, which are quite popular nowadays, are a good idea.